So many questions, and I feel so privileged to have our Minister of Health with us. Before I sort of introduce her and get going on the questions, I just want to start off with a land acknowledgement. Actually, before I start that, I just want to let people know we are recording this because a number of people aren't able to join us today, and they really wanted us to make sure that we had a recording so they'd be able to watch it later. So I want to let people know we are doing a recording, and two, we are taking photos throughout. So we always only take GQ type photos, so make sure that you smile as often as possible. So with that, I'm going to start off with a land acknowledgement. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So I think with that, I want to say a warm welcome to all of you. Thank you for joining me for this very special hour where I feel truly, truly honored to have our Minister of Health with us. When I asked her a couple of months ago, to be honest, I was hoping that this pandemic would be over and we would be talking post-pandemic. But you know, we're in the middle of it, of a third wave, and the minister's very busy, and I feel very honored that she's decided to join us in Davenport virtually. It's her second time here. For those that might not know this, and hold on, I know I have it in a very VIP spot. The minister is a member of parliament for Thunder Bay. And for those that don't know, she previously worked as the executive director of Shelter House Thunder Bay and co-author of the Thunder Bay drug strategy, which I did not know, Minister. And so anyways, I found that among many other things in your bio very impressive. Previously, the minister had come to our riding as the Minister of Employment and met with a number of youth entrepreneurs from Davenport, Perth Community Centre. And it was an unbelievable session that was very productive. And I know that the group still talks about the minister to this day. So the way we're gonna start off is we'll have the minister start off with a few words. And then if you have questions, please raise your hand. There is a raise hand function. And then Jesse's going to sort of be calling on you to ask a question. For those that don't want to ask the question live, but you want to put your question into the chat, please feel free to do so. Jesse's just going to sort of read them out and we'll go from there. Anyways, so with that, warm welcome to everyone. And I will turn the attention over to Minister Hajdu.
Okay, well, thanks so much, Julie. And my name's Cady Hajdu. I'm from Thunder Bay, Superior North. Just if you think of Lake Superior, we're just on the tip of the top there of Lake Superior, and it's a region inhabited by Anishinaabe people, Robinson Superior Treaty area, lots of Métis folks, as well as many other settlers from all around the world. Predominantly European settlers from Finland, Poland, Italy, all kinds of different backgrounds. And so I became a member of parliament about 5 years ago, and this is my third ministerial portfolio. When I was appointed to be Minister of Health prior to the pandemic, just before, actually, I was super excited. I had spent 9 years in public health as a planner in the area of alcohol and substance use. That's when I wrote the Thunder Bay drug strategy with the community, and also led a large homeless shelter, and then was elected. So I was pretty excited about getting health because obviously big proponent of prevention and access to healthcare, access to mental health in particular, and substance use supports. And then lo and behold, global pandemic. So it's been really the primary focus of my work over the last year and a half has been helping Canada respond to this global health crisis. Where, you know, Julie, I won't go through the history, you're all living it. I feel like everybody has a very in-depth awareness of where we've come from and what's happened and who's done what. And more than ever, I think people are very interested in science, epidemiology, immunology. We've all read a million articles. It's kind of a sign of the time. So I won't go through all of the history, but I'll just say, you know, where are we at now? And I know, and I feel in weird ways sort of guilty saying this because I know people have said this before and it hasn't panned out as well as everyone has hoped, but I do actually see that the finish line is, you know, we can see it. We can see the finish line. And why can we see the finish line? Well, you know, we've been living with this virus for a year and a half. And we have a huge new powerful tool in the form of vaccination. We know so much more about how it spreads and how to protect ourselves from that spread and how communities can work together to protect that spread. We've got better testing. We've got better capacity to do rapid testing. Provinces and territories are much more scaled up than they were in many different ways across the country in the very early days. And I think we just have, we know what it takes to bring the cases down. And, you know, what I'm hoping is that collectively, provinces, territories, indeed the federal government, we can all continue to make these smart decisions that will flatten this curve. And hopefully that'll be the end of it. And we won't have to go through another wave, because all of you and your communities, your families, you've all sacrificed so much in ways that I probably do know, in ways that I don't know. But I do know that the commonality is that Canadians have been sacrificing, and they've been sacrificing all kinds of things, including connections and relationships and seeing each other face to face. But in some cases, jobs and economics and ability to keep your business open, or the loss of loved ones. And so, you know, I'm hopeful that in the next couple of months, as we see vaccines really ramp up, especially as, by the way, now, we thought that the ramp up was going to start in June for real, but because we've been able to secure earlier large volume doses of Pfizer, the next few weeks, you're going to really start to feel the difference in communities about access to vaccines, because of course, millions upon millions are arriving in the next couple months. And it's going to, you're going to start to feel it, because as you may have had challenges over the last, you know, several weeks, getting vaccine appointments or getting clarity, you're going to really start to feel that volume as it arrives in your communities as early as next week. Next week's a bumper crop of 2 million in the country. It's 1 million and change each week after that. And it just continues on. And so here's the thing that keeps me up at night. Right now, everybody wants a vaccine. At least it feels like the whole world wants a vaccine. But there are folks that are scared of getting vaccinated. And we do know from other country experiences that we hit a limit somewhere. We don't know exactly where that limit will be for Canada, but that countries around the world, once you get through that surge of everybody wanting a vaccine, you get to a place where people don't want to get vaccinated, or they're scared to get vaccinated. And it's going to really take all of us kind of holding each other's hands, stepping into the light and supporting each other to do the right thing and use the tools that we know that are going to protect us all. And at the same time, we're going to have to be super vigilant about outbreaks of COVID. So we're going to have to keep doing public health things like wearing masks and protecting each other, staying physically distant, that kind of thing, until we get a volume of vaccinated people that we can actually feel confident that the virus is at the lowest level possible, so that when there is a surge, we can actually detect it quickly. Because right now there's so much COVID, it's really hard still to track, trace, and isolate. And so that's kind of been my focus over the last several months. Of course, I'm working on passion projects that are very important to me. Things like better supports for people who use substances, better research dollars, so we understand some of the other chronic illnesses that Canadians are living with. Pharmacare is continuing to be a priority for me. And of course, we have access to primary care, which has been greatly accelerated through virtual care, but nonetheless still a challenge for far too many Canadians. So I'll stop there, Julie. I hope I haven't taken too much time, but I thought it'd be worthwhile to set the stage.
No, that's wonderful. And I really appreciate it. I think it is important for everybody to just hear that the whole world is running after vaccines. And if anything, I actually feel we're very privileged in Canada that we're among the top countries to actually not only be receiving vaccines, but we have over 30% of our population right now that actually have received their first vaccine. Minister, maybe I'm going to ask the first question that I've heard a lot, and it is within our chat right now, is a number of people, they've received their first vaccine and they're worried about having to wait 4 months or 3 months to get their second dose. So they're worried from an efficacy perspective. And then they're kind of like, can you speed it up? Can we not get it sooner? And are you sure this is safe? Like, didn't Pfizer say that it should be after 3 weeks to get this? So if you can maybe address that, I'd be really grateful.
Well, absolutely. And so 2 things. I think I should start with why it is that NACI recommended delaying the second dose. And it really was based on the reality or the evidence that suggests that the faster you can get that first dose in people, the more lives you have to save, the more potential there is to save lives. But secondly, you can also drive down community transmission. And so NACI, after reviewing all the evidence on the vaccines, on vaccination and immunization in general, made this recommendation to provinces and territories, and they can choose, by the way, to accept that recommendation or not, and they did. It's very similar to the UK model of vaccination. They're also pursuing a delayed second dose approach. Same idea, to try and save as many lives as possible and drive down transmission. So it's save lives, stop the spread. It's the easiest way to remember. We may very well be in a position where people are able to get that second dose earlier because, as I said, the volume of vaccines that are coming into the country is actually far faster than we originally anticipated because of the hard work of my colleagues to work with those companies and secure firm delivery dates that are earlier. So you may find that you might get the call back for an earlier second dose earlier than you think. But the approach is really based on a premise that less COVID is the safest scenario, that it actually isn't as safe if some people have 2 doses and are fully protected and other people have no doses, that it doesn't actually decrease COVID in the community as quickly as this approach does, and it doesn't save as many lives. And what we do know is that the less COVID in the community, the safer everyone is. You know, what the whole goal is to get to less COVID. Even with fully vaccinated people, there is a potential of getting sick. If there's a high degree of COVID, epidemic or an outbreak of COVID, even for fully vaccinated people, they can get sick with COVID. Now, the vaccines protect us from really severe illness with COVID, but at the end of the day, what we don't want is we don't want COVID running rampant in communities. So that's the premise behind NACI's recommendations and why Canada has chosen this approach.
So Minister, just so we can make sure we're crystal clear and everybody knows this, just because you and I use acronyms, but NACI, they're the
sorry about that.
They're the National Advisory Council on Immunization, and they're made up of independent, top sort of medical and public health officials. Is that who they are?
They are. So they're actually researchers. The chair of the National Advisory Committee is Dr. Carolyn Quach. You can look her up online. She's an expert in immunology and infectious diseases, and there are very similar folks like that sit on the committee. And as I said, they review all the data of the vaccines, all the data of the evidence around immunization specific to COVID, but also in general. And then they provide this advice to governments, and they provide advice to provincial governments who are largely responsible for immunizing people. And then, you know, obviously the federal government is there working with provinces as they choose to accept that advice or not.
Okay, thank you. That's very helpful, Minister. And I did hear you clearly to say, given the fact that we're very blessed right now to have sort of a lot of contracts with a lot of vaccines coming in, it may be that a lot of people will be able to move up the timing of their second dose. And I think that's very helpful for us to mention. There's a couple questions around the most effective, and then there's some people who have received the Moderna dose, and they're seeing that there's less of that coming in. So they're a little worried about, well, do I have to be waiting a lot longer for it? So of the Pfizer's and the Moderna and the AstraZeneca and even the Janssen, which has started to come in, are they all equally effective? I think that's one question. Then 2, do we have to worry about, like, if a second dose, is Moderna going to be delayed in terms of a second dose? I think that's the other question.
So in terms of equal effectiveness, I'll just say this: they're all more or less equally effective at saving lives from COVID. When you're vaccinated, let's say you do actually contract COVID, the vaccination protects you from a severe case of COVID that could lead to death. And so one of the things that has been found universally in the countries that have vaccination data is that vaccinations, regardless of type, are protecting people from death of COVID. And the kinds that Health Canada have approved have a very high effectiveness rate in that category. Now you'll see different effectiveness rates, 76%, 90%. And that's really about whether or not you could even catch COVID. And so there are different findings, if you will, or presentations by the pharmaceutical companies. But those are changing too, because as the vaccines are getting more and more used, as a matter of fact, effectiveness percentages are rising. So AstraZeneca has just increased their effectiveness projections based on real life data that they're gathering in countries that have now widely used AstraZeneca, like the UK. So all this is kind of in flux, but I think that the short answer is the safest vaccine, the most effective vaccine is the first one, and we've heard stories from physicians who have actually treated really severe cases, people with cases of COVID, who have chosen to say no to, let's say, AstraZeneca, and then ended up getting really sick with COVID. And it's kind of a tragedy. And so, I think the best one is the one that is first offered to you. And if you have questions about that, you should speak to your healthcare provider or pharmacist, somebody who has some experience in immunization, to get those questions answered. It is normal to have questions. There's nothing wrong with asking them. And it's better that you get information from credible sources. In terms of people who have received one dose of Moderna, it is not as reliable as Pfizer in terms of their delivery schedules, but we do have a huge shipment coming in this week, for example, and they tend to deliver every couple of weeks. We don't think we're going to have a problem with getting people their second doses of Moderna on time. And as a matter of fact, as they get more and more sort of efficient at producing the volumes of vaccine that are under contract around the world, their delivery schedules are getting more and more reliable as well. So they were a smaller company, less experience, and they had, some, I think, stronger sort of startup challenges than Pfizer, but they seem to be stabilizing.
Yeah, and I think that just, I always remind myself, in addition to other people, that, the whole world, that's over 7 billion people that are looking for vaccines right now. And you have so few companies that are actually producing at such a massive scale. And so, again, as I said, I always feel blessed. There's a lot of question about variants, Minister, about, we have more people vaccinated, and yet it seems like we have more people having COVID. So we have this third wave, and the variants seem very, very strong and stubborn. So I think people are a little bit worried about sort of the effectiveness of the vaccine sort of now and sort of ongoing against the variants. So if you could maybe address that. I think there's another question about long haulers, people who for some reason have continued to have had sort of, it's taken them a while to recover from COVID. And so they're looking to see, is there a bit of a game plan maybe to be supporting them? I think and I think the last question was around vaccine passports, and if we're starting to think about that.
Okay. So on variants, the safest thing with COVID is to stop the spread, because variants arise when COVID is allowed to replicate rapidly. And they're really hard to detect. Countries, we know some countries that have detected variants, they usually aren't able to even report out on that or understand what they're seeing in some cases until way later. So the UK variant, they suspect arose somewhere in the early November, mid-November range of 2020. And it wasn't until sort of the end of December-ish that the world was alerted that there was this variant of concern. The variants of concern are concerning because they have measures that may make them more infectious. Some may be more nasty, more lethal. Some may be vaccine escapant. And a lot of research goes into trying to figure out where these mutations on the genetic code of the variant, where they lie and what that might mean. And of course, it's partly research and science that's examining the virus itself, but it's also looking at how the virus grows over a large volume of people and its fitness. They call it its fitness, whether or not it replacing, sort of the, old school COVID, I guess. And the reality is, the good news is that the same things that protect against COVID protect against cases of variant COVID. The challenge is that sometimes if they're more infectious, then it's harder for households to do those things. So while as the original COVID, perhaps if you had a household of 5 or 6 people, maybe 2 or 3 would get sick, maybe now what we see with variants is that the whole household could become infected. And that's the challenge, is it's more infectious. And so even those kinds of things where you might be trying to sleep separately in different rooms and trying to make sure you're not using the same, dishes and sharing the same space isn't as effective as it was originally. And that's the reality with these variants, is they are concerning. That's why they're called concern. And again, the more that we can do to prevent the spread of COVID, the more we do our part to prevent the spread of variants, because they are very treatable, if you will, by the same kinds of things that we would use to prevent the spread of COVID. You know, washing our hands, staying physically distant. The challenges is that if you're in a space where you're sharing that space with people, or you're in a workplace where you're really close packed, you know, well, as you might have just had a better luck with the original COVID, you may have a higher chance of catching it if it's a variant. That's the one thing. The other thing that people worry about a lot is whether or not the variants will be escapant from vaccination. And that would be, you know, a real setback. And there's some evidence that some are mildly less impacted by vaccination. Luckily, we don't have many of those in Canada. But, you know, not to say that we couldn't. And again, the best way to protect against variants is to not allow the virus to spread. And that takes really everyone working together. I'll say COVID is a ton of work. It's work at the community, it's work at the personal level, at the community level, at the provincial level, at the federal level. And when there's an outbreak, everybody has to swing into gear. And I've been saying this, you know, to community members and community groups, that whatever we can do to help people, for example, isolate when they're sick, the better we all are off, because, you know, it's very hard. Anyone who's had to isolate will realize this is not easy, especially if you're sick, and especially if you're alone or you don't have people to help pick up groceries, that kind of thing. So we all really are in this together. And, you know, we're in it worldwide, right? Because we, you know, we have to actually be, while we're working on our own domestic spread, trying to do our best to help be part of an international response to COVID, so that we can have some relief as a world. That's why it's important where we stay a member of the WHO, and that we contribute to COVAX, and that we help countries that are experiencing surge with equipment and money, and because it's got to be team world, and then within that, team Canada. And then in terms of long haul COVID, yes, there's a lot of research happening in this space. People are not quite sure yet what that means, and what the best effective treatments are, and whether or not people will have it forever, or what will help. And it's so different from person to person. But there is a ton of research investment right now on trying to understand the long-term impacts of being infected with COVID.
Okay, thank you. And I think I had mentioned the vaccine passport. Did you respond to that?
Oh, sorry, yes, on the vaccine passport. So it's a pretty, I would say, emerging space. You know, people think that we have a strong opinion one way or the other. Here's where my strong opinions lie. One, Canada can't be left behind, because people will want to travel internationally. So we should be prepared to have certification for Canadians that say they've been immunized, that will be acceptable by other countries who will demand a vaccine certification. That's the first thing. So we can't be left behind. So we have to figure out how we make sure that no matter what province you're in, you have a certificate that is accepted internationally, that potentially is digital, but whatever, lines up with the international community and where that's emerging. And countries are starting to kind of settle in to deciding whether or not they're going to require proof of vaccination. And then the next big decision is, do we need proof of vaccination to come into Canada? And I would say that my sense is it'll be a bit of a hybrid for a while, that we'll, you know, for fully vaccinated people, begin to alleviate some of the measures around quarantine and testing. Not yet, because we're still, again, so fragile in our own vaccination strategy. And again, don't forget, you can get COVID when you're vaccinated. We don't know how transmissible it is when you've gotten COVID when you're vaccinated. But we will have to be thinking about, and we are thinking about, what vaccination, full vaccination, means at the border, and whether or not that will alleviate people's obligations to quarantine and test. And then I think further, whether or not, what kinds of vaccinations will we accept? We know, and we have confidence in the ones that Health Canada has approved, but we don't, do we have confidence in Sputnik 5 or you know, Sinovac, or some of the other vaccines that have been approved in other parts of the world and developed by other countries that we haven't seen their data or their effectiveness data. So those are the questions that I think all of the teams are wrestling with, including health, but also global affairs, and many of the other ministers that have their finger on this pulse.
Okay, thank you, Minister.
I know it's, you know what? I feel like when I'm giving you the answer, it's kind of like, I don't know, wait and see. But the reality is with COVID, so much of it is, well, you know, we're trying our best to stay up with the science, but the science and the research and the sort of evolution of it has not fully landed. So I'm not trying to be cagey. I'm trying to be candid and tell you everything I know.
No, it's been really helpful. And I almost want to just give you a bit of a pause. There's a number of questions in the chat, and I just want to people sort of warn them. We're not able to tell people when the vaccines are going to be available for the M6H or M6E postal codes, just to let you know, or when the vaccine pop-ups. One of the things is, and I know the minister will in her answer sort of reinforce this, but you know, the federal government provides the provinces and territories with the vaccines, and it really is up to the provinces to actually distribute it. And it really is the provinces and the cities that make those determinations. We do not at the federal level do that. Minister, now we've got about 7 people who want to ask, and I know that Lazar, Lazar, I love that you have your hand up, but you don't know how to put your hand up. But anyway, so I'm going to do 3 at a time, if that's okay.
Sure.
So I'm going to do sort of Morgan, Susan, Lazar, and then I'm going to move to Edward, Deanna, Peter, and Chris. Okay. So Morgan, you're first up, but Morgan Wyatt. So you just want to ask your question.
I'm Morgan Wyatt. Thanks for coming on this. I just have just a little background about myself. I spent 10 years academia doing microbiology and chemistry research. So I have a feel the fact that there's 10 times more bacteria living on or in us than there are necessarily viruses. And when you speak to what our end state goal is and where we're crossing the finish line, I'm just wondering what that finish line actually means, because we're never going to get to a place that truly ends COVID, and because it's always going to be around. But what is actually what are we measuring for? Because cases actually don't matter as much anymore because the treatments have changed. We're always going to live in the state of this. What is the end state goal for Canada, and what are we measuring towards?
Okay, thank you, Morgan. Now we're going to go to Susan. And Susan, if you could maybe unveil yourself. It's always nice to see someone when they're asking a question. Thank you. Over to you.
I have COVID hair.
Oh, okay, we all do.
Thank you so much for doing this for all of us. I'd just like to say that it's really nice to see so many interested people. And I think this is a great forum. My first occupation was nursing, so I'm very interested in this. I think the World Health Organization is probably going to take over the immunization records for those people who have been vaccinated. For those of us who like to travel, you can't really go to another country unless you've had your polio vaccination and whatnot. So I think COVID is going to be in that line. I just have a concern about the AstraZeneca, the second shot. I don't seem to be able to go on the ministry's website and book my second shot. I'm not sure why that is, or if it's because it's not yet here, or if we don't know where we're going to go for that. So that was my main concern, really.
Well, thank you. Thanks so much, Susan, and really appreciate you being here.
Yeah, thanks.
Next, we go to Lazar. So over to you, Lazar.
Hi there. Happy to be here, everybody. I'm here with my housemate, Gary Adams, and we have a question about rapid testing availability in our community. This whole pandemic, about a year in now, it seems the vast majority of the population only has access to temperature guns. So we're part of a volunteer organization. We have a box right here of 100 COVID rapid tests. We've been going around training people how to administer them. We'd like to know if Health Canada is considering how to write guidelines for community-led testing, or making rapid testing more available outside the medical system at the community level.
Wonderful. Thanks so much, Lazar. Okay, back to you, Minister.
Okay, well, thank you. What a great diversity of questions. So Morgan, great question. What does the finish line actually look like? I would say it doesn't look like India. That's for sure. And the reason I say that is because they thought they were out of the woods, right? And I think what we want to be sure is that when we're out of the woods, that we have the healthcare capacity to support people who do get sick with COVID, just like we do with the flu every year. And, our healthcare system, by the way, bursts with the flu, but it's, so much worse with COVID. And the reality is we have to be in a place where we can manage it as a society and as a community. And that's why I think vaccination is so important. So it's really a matter of knowing and having the confidence as communities, as a province, and as a country that we have the tools that we need to actually put out the flames of COVID. Because to your point, I mean, there are those folks that believe in COVID zero. And listen, I think shooting for zero of some of these infectious diseases is great. It's a great goal. Look at the work that's been done on polio and smallpox and all of those kinds of diseases. But it takes a lot of time and many, many years and many, many groups that will do this when we see the sort of endemic state that we see COVID-19 now in the world. So from my perspective, it is a comfort level that we have the tools that we need and we can manage whatever surges that come our way, and that we have tools in place to actually save lives when we see those surges, including the hospitalization capacity. And that's a delicate balance. So do I have a percentage? No. Do I have, it's a delicate balance, but I do know that, we don't have it yet. And we can see that throughout the country where we see surges that create such a high degree of pressure on our healthcare system that not only people who are getting sick with COVID are not getting treated, but so are people who are getting sick with other things or having to defer their surgeries and all of those other kinds of things. So I don't know how satisfying that is to you, but
I just wonder if it's a health.
No, I'm really sorry, Morgan. I'm sorry we've got so many other comments. I'm sorry. Sorry about that, Morgan. Sorry, not a discussion.
She's not going to let us have a conversation. I feel you though. But it's an ongoing question, Morgan, and people are asking that question, and they're working on trying to figure out where it is that we as a country feel that there is a safety net that's strong enough to be able to manage it. With the overarching goal that, of course, eliminating COVID would be grand. I just don't think it's going to happen overnight. And then in terms of, Susan, the WHO collecting immunization records, I actually disagree with you. I don't think that's going to happen. They actually don't collect immunization records from Canadians right now. And in fact, when you travel internationally, not all countries require proof of immunization for polio or other things. I've traveled internationally in this job, and rarely am I asked anything about immunization. But there are some that, for example, there are some countries in Africa, on the continent of Africa, that require a yellow fever immunization to enter. There are some diseases that are monitored very closely by countries that have a very distinct interest in making sure that those diseases are not transmitted on their borders. I do think it's going to be some form of international standardization, kind of like passports, where there's a certain way that passports can be scanned by machines to indicate who you are very quickly to the people that are doing it. I think that's probably where we'll land, but I don't think there'll be centralized sharing of data. We can't even share data amongst provinces and territories all that well. I just can't imagine the world could get their act together to be able to share data in that way. Those of you who think that this is a global conspiracy, I'll tell you right now, there is not the sophistication level to be able to do any of that. Nor is there a desire by countries to share that very personal data with anyone else. And then in terms of AstraZeneca and booking your second shot, I don't know why they haven't booked the second shot. I also have my first shot of AstraZeneca as of last week, and I didn't get a second shot booked either by the province of Ontario. So I imagine they are waiting to see about when the next doses will come in. Not to fear though, those doses will come and we will get our second shots. So hang on and follow up if you don't hear from your health unit or your provider. And then Lazar, we have shipped, and I wish I had my little chart of numbers, but in the range of, I don't know, I want to say 5 million rapid tests. I might be wrong, but millions and millions of rapid tests to the province of Ontario. And they've deployed a very small percentage of them. And not only did we ship tests to the province, but we also provided guidance on how to use them. And then we actually helped corporations and companies deploy rapid test pilots. And then we actually shared best practices that include, for example, community testing that's happening in Nova Scotia and other places. So we're trying our best to get people to use every tool in the toolbox. I did notice that someone asked, what about at-home tests? Health Canada has just approved an at-home test. We don't have any currently available in Canada, but we are working right now to try and figure out how we can buy some as a country and then distribute them to provinces and territories. I agree with you. Rapid tests will help. They're not a silver bullet. There is no silver bullet with COVID, but they're an add-on tool. And if used well, they can certainly help. One downside to rapid tests is sometimes they can give people a sense of assurance that they don't have COVID when they do. And that happened to a very high profile group of people in the Vancouver Canucks. That's exactly their story. They were being rapid tested every day. And one day they decided not to wait for the return of their rapid test because they had had one the day before. And they felt very certain they hadn't seen anyone, nobody was sick, blah, blah, blah. And somebody was sick. And they got on the ice and skated hard and sweat all over each other and brought the team down. So I tell you that cautionary tale, not to scare you about rapid tests, but just to remind us that, you know, it doesn't mean you're alleviated from practicing the public health measures. You have to do both. You have to do screening and also be rigorous about protecting each other.
So thanks. So I'm going to go to our next 4 questioners, but what I do want to add to your rapid test is only 50% of the rapid tests that have been sent to Ontario have actually been used. So whether it's 5 million or 4 million, whatever the dose is. And Minister, we had also made an announcement just over a week ago about the federal government sending more rapid tests, but directly into the cities. So City of Toronto, city of some of the Peel cities who really need to sort of access those, and directly to workplaces as well. So I'm really glad that that's happening. And thanks for letting us know about the at-home test and the approval. Okay, so we've got Edward, then we've got Deanna, Peter, and Chris. So Edward, why don't you go next? Please ask your question. Oh, hold on. You have to click the unmute button. It says
there we go. Sorry about that. Classic. So thanks so much. I work as an emergency doctor here in Toronto, and I'd like to thank you for your ongoing leadership during the pandemic and your message right now about getting the first vaccine available. I'd like to ask about another issue actually that's facing my patients, which is being able to afford their medications. So we know that hundreds of thousands of people in Canada have lost their employer benefits and millions are financially struggling. And back in 2017, I think it was, the Parliamentary Budget Officer estimated that universal publicly financed pharmacare could protect millions of Canadians from having to pay out of pocket by an average of 90%. And the Hoskins report laid out a timeline for launching pharmacare on January 1st, which is 7 months away. But I noticed that it wasn't there wasn't funding for this in the new budget. So can you tell us how your government will achieve universal public pharmacare, and you know, how will it give Canadians an essential helping hand to launch our recovery?
Mm-hmm. Well, thanks very much, Doctor, for your work also. And there's one of our healthcare heroes right on your Hollywood Squares there. So people know that you're working really hard and that your colleagues are working really hard. So thank you. You're absolutely right. And
Minister, sorry, can I get 3 more questions?
Oh, sure. Yeah.
Respond? I wanted to also thank Edward, one for being here and asking an excellent question that is on the minds of many Davenport residents. So thank you. Next, we have Deanna and then Peter. Deanna,
right.
You're next.
Yeah, thanks very much. So I was the one who actually raised the question before about COVID long haulers, and I was really glad to hear your response. And I know there's research being done, but I think probably this makes more sense if I follow up with your office and that of Julie's, because I'd really like to dig more into that in terms of, you know, what's being done, who's doing it, and looking at the collaboration and the you know, on that. I know there's a very active group of a coalition of people who are long haulers themselves, and they're working really hard to really bring this to the forefront and to get the clinical support, which I realize is much more of a provincial issue, to help them out as well. So I think, you know, I'm glad to get your initial answer, but just FYI, I'll follow up after this, because I also have to leave in a few minutes too. Thanks.
Thanks so much, Deanna. Bye. Okay, next we have Peter Love. Welcome.
Thank you, Minister, for being with us. I'll be very brief. COVID is obviously on top of mind for everyone, but there's another epidemic going on in this country right now. That's deaths from overdoses of opioids. And I wondered if you could briefly tell us what the federal government proposes to do to address that problem.
Thank you. Thanks so much, Peter. And then last but not least, Chris, in this round, Chris Thomas.
Hi, and thanks for coming, Minister, and thanks for having us, Julie. Also, a big thank you to Edward, because he kind of asked the question that was on my mind as well, and I think it's really important to have a lot of physician support for this kind of thing, so I appreciate that. I worked in HIV prevention for about a decade here in Toronto, so I've seen the kind of deficiencies of our patchwork system very close. And so I don't have a ton more to add beyond what Edward stated. I just want to kind of remind everybody the kind of role that the federal government played in the kind of first round of Medicare, and the very strong role that they can play in achieving universal pharmacare. Just note that among the kind of folks who organize around this, the kind of cycle of promise and not deliver is breeding a lot of cynicism around a lot of people who want the best for their patients and the people they work with, and just noting that that's getting very exhausting. So what kind of plan is for getting to pharmacare? Thank you very much.
Thanks so much, Chris. Appreciate it. Okay, back to you, Minister.
Okay, well, all great questions. And so Edward and Chris are kind of attached, but I'll just say also, Chris, thanks for the work that you're doing on HIV prevention and with HIV patients, no doubt. And, you know, it's an aside, but I had an epiphany one day when I was talking to a friend of mine that I've been friends with since I was 17. So, you know, I got to be a young woman in the 80s, best decade, I gotta say. But the 80s is when HIV kind of burst onto the scene in a big way. And this friend of mine who is a gay man in my age has a really hard time talking about COVID. And I realized one night when we were chatting on the phone that he was experiencing some form of kind of post-traumatic stress. And I just wondered if you have clients that are feeling this, because they lived through a pandemic. You know, we keep saying this is the biggest health crisis and, you know, it's unprecedented. Well, it's actually not unprecedented. The HIV/AIDS crisis was just as explosive, and it continues to this day. It's still a pandemic, still classified as a pandemic that hasn't ended and still infects millions upon millions of people. So I just want you to know I thank you for the work that you're doing, and especially with a group of people that may feel somewhat traumatized by going through another pandemic, and this one with so much attention, when some people my age remember not a lot of focused attention or research. I will just say that on pharmacare, we are moving forward. There's a rare disease strategy consultation that's just concluded. We have a Canada Drug Agency that has been stood up, and I has an interim president, and the interim president has been instructed to work on a formulary. And the formulary will form the basis. And this will be essential medicines. My vision is obviously, listen, I think everybody would love to have a list of 30,000 medications, but it'll start with an essential medicines list as per the Hoskins report. And this medication list would form the basis of negotiations with provinces and territories. And you're right, there's not a money line in the budget, but there is a commitment to continuing to go forward. And I think the vision is, from the Prime Minister's perspective, is that we get through COVID, and you've heard him speak quite openly in press conferences and in the House, that there will be a conversation about boosting healthcare transfers. But I think there's an idea, my idea, and I don't know if it aligns with the Prime Minister, but I'm kind of hoping that it is aligned, is that we do this restoration, reformation of our public healthcare system when we start to have those conversations about what the system of healthcare is across the country in a much more robust way, and that scopes in pharmacare, because we'll have the foundation in place. You know, we've committed to universal pharmacare, and we now have, as I said, an interim president. The formulary is getting you know, sorted. It will, as I said, need to be consulted on, but I think we've got a really good, strong foundation, and there's no desire to go backwards. So, you know, I don't know what more you have, what more I can give you other than it is in our budget. You're right, it doesn't have money attached, but there's also a person in place and an agency in place and a rare disease strategy coming together. So movement is happening. It is slow, but I think it is quite feasible. And then Peter, on opioids, I mean, this is a topic that's near and dear to my heart. I started working on opioid overdose, you know, 20 years ago. I feel really old saying that, but it was, you know, before it was cool to talk about drugs and cool to talk about harm reduction. And we really had to sort of push to even get people to recognize people who use substances as worthwhile as having an intervention that would be based on compassion. And so that's the those are the values and the history that I bring to the work that I'm doing. And in fact, the budget has, I can't remember how much money, but a significant contribution to continuing the substance use, it's called SUAP, Substance Use Access Program, I think it is. But essentially it's money that directly funds organizations that work in community with people who use substances for harm reduction or other kinds of supports for people who use substances. And I don't think that's the only answer. I think substance use, access to treatment, access to harm reduction is all very important. But I think the stuff that we do at the federal government on housing, on income maintenance and support, on boosting things like Canada Child Benefit and support programs, I think all of those things are important as well. You can't have a healthy society if you have an unequal society, if you're not taking care of everyone, if people don't have a fair chance to succeed. The investments we're making in young people, especially young people who are the most detached from school and work, very important in terms of using that as a prevention tool. So there's more to do. I'm working right now with Vancouver and the province of BC, who have asked to explore decriminalization, and BC has just begun to submit some materials about how they might approach that. And we've been very open to having those conversations with communities that want to proceed in that direction. And again, it's a sensitive topic for some communities. Other communities are very, very ready to pursue that. I don't think there's one silver bullet. I come from a long line of substance users. My family has been intertwined with alcohol and substance use my entire history, probably their entire history. And so, I have seen this subject from a very personal inside out place, as well as a professional place my entire life. And I think that it is got to be a holistic approach, that when we're saying that there's one thing that will fix this problem, then that person has forgotten the complexity of human beings and the complexity of people who live in oftentimes excruciating agony, or who suffer emotionally, or who suffer in other ways. And I just think we have to start everything that we do. Every conversation we have about substance use has to be rooted in compassion and dignity, and an understanding that it's complex, and that there are many, many things that we can do at the federal level that may not seem directly connected to the opiate crisis, but in fact are. So I hope that is helpful.
Thanks so much, Minister. And there is a line item, I think, that we have put some budget within our budget 2021 to actually continue to tackle.
Yeah, I was trying to remember how much, but it's lots. It's in like the 60 million, maybe more category. And there's also, will just add on, I'll just give a little pitch to wellnesstogether.ca. The federal government has stepped into service delivery sort of in a partnership capacity, providing mental health and substance use supports, direct supports, crisis supports, all completely for free. So you can visit wellnesstogether.ca and you can get connected to a system navigator or a counselor online or a counselor over the phone for emergency counseling, for longer term counseling. It's not perfect yet, but it's getting better and better by the day. And about 3 million distinct user sessions, 1 million people have used it. So please let your clients and your friends and your family know. It's completely confidential. And it is a great place to start for some folks that are really just feeling isolated and don't have access to those kinds of supports for one reason or another.
Thank you, Minister. So we've got 5 questioners left, and I'll give them each 1 minute, and then you could sort of respond, because you do this so well, responding to all at once. I will, though, sort of start off where you ended off, which is mental health. I think that everybody feels like their mental health has been impacted. We're worried about our kids. We're worried about our families. We knew that there was already too little mental health support before this pandemic started. And so much more money and so much more focus is needed. Lena, who's in the car, she runs a renowned sort of best-in-class program for youth, tackle behavioral mental health issues. And she's been phenomenal in our writing. Don't have more time to chat about her, but I would love, as part of your answers to the 5, if you could talk a little bit more about whether that's going to be one of our priorities as we come out of this pandemic. But if you could talk a little bit more beyond the wellness, that would be really appreciated. Okay, so the lineup is I have Nuno, Cady, Simon, James, and then Susie. Okay, so Nuno, you're next. Welcome.
Hi. Hi, Minister. I am B.
Hi.
I'm a Portuguese journalist. I represent Correio da Manhã Canada. Hello to the entire audience. So as the restaurant sector is strong in the Portuguese Canadian community, what is the possibility of workers in this area being included in priority vaccination groups? Another question, are there plans for the Portuguese community to have access to mental health in the mother tongue? There are many elderly people here in the community who need this support. Thank you so much.
Thanks so much, Nuno. We're just going to go through all the questions at once and have the minister respond. So thanks for that. So next we have Cady.
Okay, it's Cady, by the way, but that's okay.
Cady.
That's okay. I very quickly, I want to know, there are 300,000 doses of the Johnson & Johnson that have arrived, and how are they going to be distributed? And there's another vaccine, I think it's called Novavax, that it's going to be produced actually in Montreal. Is there some kind of timeline about that? And the other question is just a curiosity question. What happens when you think of they have arrived? How do they arrive? Like, do they come by boat? Do they come by truck? And where do they go? Do they go up to Parliament and you store them there and then distribute them? I'm curious why nobody, you don't have a journalist kind of following the truck. Anyway, that's just a curiosity question.
Okay, thanks so much. Next we have Simon.
Hi there. Yeah, thanks. Scott, I live in the neighborhood, and I just wanted to ask a particular question about solving this as a global challenge and the role of entrepreneurialism. And we've seen entrepreneurialism, manifest in ways that I think have delayed some important programs that have needed to be rolled out, whether that's last summer's youth programs or additionally the entrepreneurialism of proprietary vaccinations that India and South Africa are proposing to be changed. And I wanted to ask the minister, why has the Liberal Party not supported that global proposal for a solution to improve equity and access to vaccines? Where is the comment directly to that? Like, we're talking about supply chain. I want to understand why we're not making our position known on a global stage on the right side of access to healthcare.
No, appreciate that, Simon. And Minister, that definitely is a question on behalf of many Davenport residents. Thank you. Okay, next we go to James.
Hi, Minister. My name is James Finlay. Thank you very much for being here. You touched on this earlier, but I wanted to follow up on it with respect to data capturing within Canada. It's a pretty well-known fact that our data sharing agreements between the provinces and the federal government's somewhat lackluster. The capabilities there, frankly, don't reflect the kind of country that we are. I was curious what measures the federal government's taking to try to address that. And then just to tack on to that as well, we went from being a world leader with respect to surveillance and intelligence gathering, and it seems that we might have fallen behind the pace there as well. So just curious to know what we're doing to resolve that. Thank you.
Thanks so much, James. And then last but not least, we have Susie.
Sorry, and then I think Sharon wants to ask a question too.
Well, I think
okay. My question is I'm watching all the variants, and it seems like COVID's going to keep on varying. And so the end goal is it looks more that we can't get rid of it. So somebody kind of mentioned to me, do we need to get vaccinated like every 8 months to a year? And the other question is, I own High Junction Gymnastics, and I've been closed pretty much the whole time with kids. What's it looking like for them getting vaccinated?
Well, great questions. Thanks so much, Susie. Okay, back to you, Minister, and I think we'll just shut it down.
Sharon.
Oh, no, no, I think we've run out. I'm sorry, it's 7 o'clock and the minister has to still respond to 5 questions.
Okay.
Sorry. Sir, go ahead, Minister.
Okay, well, thank you very much. And thanks to people like Lena who are working on mental health for youth. And I know how exhausting and fulfilling that is. So thank you, Lena, because it's not an easy job. On mental health, the additional things that we're doing besides funding, I'm a big fan.
I'm being evicted. That was my question. Eviction, mental health.
Okay, well, that's a really terrible situation, Sharon.
Yeah, I wish I could have talked.
Well, you must be really stressed out right now. It must be very terrifying for you right now.
Sharon, why don't you call my office to make sure? So my staff is going to send you a phone number right now. So chat with us tomorrow. Let's see how we can help you. Sorry about that, Minister. And thanks, Sharon. So please go ahead, Minister.
Okay, well, it's a perfect segue. People are feeling really scared and people are feeling really stressed, and people like Sharon are feeling really, really vulnerable. And so I think it's a really good reminder that there are people amongst us that need support. And so in terms of the work that we do to provide that support, we do actually fund a lot of work at the community level. And so, Lena, for example, you might have even intersected with organizations that receive federal funding for young people who, for example, have been, they're not in school, they're not in work, and they need skills training. And we actually reformed that type of funding to be, first of all, longer term, so that community organizations can have a longer stability of funding to be able to work with people, because we know that it takes longer than 6 weeks sometimes for people to sort out what to do next, but also to provide the ability for people to have that second chance older, to be able to access those types of programs when they are older than 24 or 25. Sometimes it takes a second chance, a third chance, a fourth chance. And then to provide the flexibility within programs to be able to do what they need to do to work with young people. What we heard consistently over and over was that not one size fits all, and that job skills training has to also scope in trauma and loss of a living place and disconnected families. And that's all through, by the way, Employment Social Development Canada. That's not even through Health Canada. That's actually through other programs. So, when we look at what the government of Canada does, it's really hard to sort of just define in one program. But I would say that this government, our government, has been focused on fairness, on giving people a fair chance, on trying to help lift people up, and trying to make sure there are programs out there that support the great work that's happening in communities, because communities and community groups and people that are working in community know best what works. And these, big, large programs often are not able to reach the people that need it the most. Nuno, vaccination for frontline. I would imagine the types of people that you're representing right now are going to be in the next phase of the vaccination. Frontline workers are in Ontario's sort of phase 2, and that question's better posed to your MPP. But I'll tell you that I know that it is young people that are on the front lines, and the young people have taken an incredibly bad rap in this pandemic. We often want to sort of yell at them for gathering, but in fact, they're the ones out there cooking and delivering our food. And they're the ones out there keeping our stores open, and not always and exclusively, but a lot of times it's young people. And so I just implore us all not to beat up on young people when there's an outbreak. It's not the young people that are partying. Sure, maybe there are some, but no more than the 30-year-olds or 40-year-olds. And so I just want us all to be compassionate to the young people who are working so hard, because Nuno's question reminds us all that it is often young people that are doing the jobs that are keeping us in toilet paper and takeout food. And I want to thank them all. Cady, you asked about Johnson & Johnson, what's going to happen. Actually, it will be distributed to the provinces and territories on a per capita basis, with the idea that they'll use it in the most vulnerable. It's a 1-dose vaccine, so it's perfect for things like concentrated work settings, people that can't come back from multiple appointments, people living in homeless shelters or in marginalized communities. And so we'll be having that conversation with PTs. They will get their per capita allotment, but we're going to encourage them to use them in these specialized populations that are having a hard time accessing vaccination. There'll be more J&J coming, but this is the sort of down payment. What happens? What does it look like? Where does it go? Well, they do arrive on planes, believe it or not, big planes, cargo planes. And then they're checked by Health Canada officials who check the lot number and the dose number. And some of them are actually, some vials are actually taken and tested in labs to make sure that they meet the criteria that were specified in the data that Health Canada has received, and they're all inspected. And then they're distributed further on by plane to provinces and territories who receive them at certain designated places that they've asked for. And they're actually very hotly guarded secrets where they're stored, because there's vaccine pirates right now, and there's theft, and there's all sorts of corruption. And so even where we store them, I don't even know where the Health Canada warehouses are. But there are warehouses for Health Canada across the country, and then provinces and territories have warehouses across their provinces and territories. Some of it goes directly to specific clinics, like Pfizer has designated a certain number of clinics, and the provinces chose which ones, so they get delivered directly to those clinics. And Novavax, the timeline, well, we are waiting to find out about when we would be able to get a line of sight on Novavax. But we are very happy with the shipments coming in from Pfizer in particular and Moderna. 48 million will arrive in our country before the end of June. So that's crazy. And it kind of ties into the next question about Simon. What are we doing in terms of our contribution to COVID as a global challenge? And you're right, we can do more. And so those excess doses that we've purchased, we will be contributing back either through a mechanism like COVAX or bilaterally to other countries that are really struggling. You know, I don't know the answer to what I think you're referring to, which was the proprietary stuff at the WTO, but maybe Julie, you can get that answer from Mary Ng, because I know that as the Minister of Trade, she's very immersed in that. I'll just say that there's always a trade-off with those kinds of things. You have to keep those companies incentivized to continue to manufacture, but listen, everybody knows that that we're all in this together, and we have to get the rest of the world vaccinated as well. Canada is one of the largest contributors to COVAX, and we're going to continue to be there with vaccines and with options, and of course we'll be there for countries as they're struggling financially. Someone asked, I think it was Cady, about, or James, Susie, it was Susie. What about the variants? What is the end? I kind of answered that earlier, but I'll just say in terms of boosters, there is some sense that we might need boosters, given that this virus does evolve, given that what we know about coronaviruses. And so we're already actively working to procure boosters and second generation vaccines, so that much like the flu, we would be prepared to provide that to Canadians once we get a better understanding of how long vaccines last and what the length of immunity is given the variants and how the virus is changing. And vaccines for kids, Pfizer is the only company so far that's applied for approval for vaccine use in 13 to 18-year-olds. And my understanding is they will be providing an application in later in the summer for the younger age group. And I can't remember how young, but it's quite young. It's like 6 months to 13. But don't quote me on the younger side, because I'm not exactly sure, but it's very young. It's like in the baby age. So that's coming. It's coming. And, you know, just to say on those manufacturers, they develop those vaccines so quickly. Typically a vaccine would be tested in a multiple kind of age groups like that prior to applying for approval. But of course the world didn't have the time. So they went with adults first. And as you know, even pregnant women had to be sort of added on later on. But now that we're seeing such success in adults, and we're getting the safety data that we need, and they're able to test in these younger age groups, we're getting better certainty about the safety for those age groups as well. And then James, boy, I feel your pain. The data sharing, I don't know what more we can do. We gave $4 billion to provinces and territories to help them bring their data tools up to speed and to bring some integration. But they're all using different systems. I don't know if you're a data person, but if you've ever done any kind of data integration, It's not as easy as just sort of, you know, sharing USB files. Like these systems have to talk to each other, and there has to be a motivation on the provinces and territories to want to do that. Certainly the money helps, and we are getting some better data, but there's a long way to go. And on GFIN, we fully restored GFIN to its sort of full capacity. I'll just say this, I know that that story has been really, really hot, but I will say from the bottom of my heart, that really was an administration decision. I was not the minister. There is no record on file that any minister ever made that decision. And some administrator made that decision, and it did. Dr. Tam is sure that it did not delay her knowledge of the virus. Nonetheless, it was a very important tool because it gave signals not just to Canada but to the world. So there was a difference between a notification and an alert. I get these notifications every day. It talks about emerging disease trends and all kinds of things, but the alert is something that went out to other countries, and it said, you know, red flag, we've noticed something. So my expert panel said that this did not delay Canada's knowledge of COVID-19, but that of course it provides a critical tool to the world as well as to the country. And so it's been fully restored. And I think the scientists working in GFIN are quite happy to have their capacity to do that work back.
Thank you, Minister. My gosh, that is like a huge sort of, you've done
like
such
a data dump of all COVID things for.
Yeah, you know. No, you've done great. I will just sort of add the two sort of quick things about, in terms of to third world countries or people that need it outside of Canada. I do know that the Prime Minister also promised that any of our excess vaccines that we will also be, I think, donating that as well. And I also know that we've made an announcement that we are going to be having boosters created in Canada in 2022 and 2023, which I think is important to know. Anyways, I just want to sort of wind down just to say a huge thank you to you. Thanks so much for all the amazing work that you're doing. Let's give a big Davenport sort of thank you to the minister, you guys. So thank you so much. Really appreciate you being here. Sorry for the rapid fire. It's as you could tell, there's a lot of questions. For those that didn't get a chance to ask questions, please make sure to call my office tomorrow. I'm happy to follow up. I don't want anybody to feel that they're not going to get a chance to be able to get support or help or to be responded to as quickly as possible. But really appreciate all your time during this unprecedented period, Minister, and thank you so much for your leadership. And thanks for making the time to visit Davenport. Take care. Have a good night, everyone. And
Bye,
thanks
everyone. Thank you so much.
Bye.
Bye. Thank you very much.